Hi, this is Starlin and Holly. We are going to interpret our EKGs using the Dubin method. I will start first. This rate is 75 beats per minute, the atrial rate and the ventricular rate. The rhythm, there is a P wave for every QRS complex. Each P wave is upright. The PRI is less than 0.2 seconds or one large box. And the QRS complex is regular and less than 0.12 seconds. This tells me that there is no heart block. The access, the lead in lead 1 and lead AVF, their deflections are both positive. This tells me that there is a normal access. Looking at hypertrophy, in V1 and V6, there is no diphasic P wave. Telling me that there's no atrial hypertrophy. Now looking for ventricular hypertrophy. In V1, the S wave is about 5 millimeters, and in V6, the R wave is 20 millimeters. This does not equal 35, so that there's no left ventricular hypertrophy. Now looking for any T wave inversion, and there's no T wave inversion. There is ST elevation slightly in V1 and V6, and severely in V2, V3, V4, V5. This tells me that there is an anterior acute ischemia that involves the LAD. There is no pathological Q waves evidence, no necrosis. In summary, this patient is in normal sinus rhythm at a rate of 75 beats per minute. There are P waves for every QRS complex. The access is normal. There is no ventricular or atrial hypertrophy. There is no T wave inversion. The ST elevation is in leads V1 through V6 with no pathological Q waves. The patient has an anterior acute MI, which is affecting the LAD. Now moving on to Holly.
Okay. So hi, this is Holly. I'm going to do the same for this second EKG. Looking at the rate initially, the atrial rate is undetermined. The ventricular rate using the Dubins method of 300, 150, 100, 75, 60, and 50. I'm calculating approximately 200 beats per minute. Second part is rhythm. The rhythm is irregular. It's an irregular ventricular rhythm, and there are no P waves. There are no P waves before each QRS, and the QRS interval is approximately 0.08, which is in the normal range. Looking at V1, there's possible fibrillation in the P waves, but it's hard to determine. 3, axis, looking at leads 1 and AVF. Lead 1 is upright, and AVF, the QRS is upright as well, so that's a normal axis. Part 4, hypertrophy. There's no P waves, so I can't determine for atrial hypertrophy. But in lead V1 and V5, I'm going to look for ventricular hypertrophy. And in V1, the S is less than 2 boxes vertically. And the V5, the R wave, is less than 3 boxes. So it's less than 7 big boxes or less than 35 millimeters. So there's no signs of left ventricular hypertrophy or ventricular hypertrophy at all. Part 5, I'm looking for infarction. There's no significant Q waves. I don't see any inverted T waves. And there's no noted ST segment elevation or depression. So in summary, the atrial rate is undetermined because there's no P waves. The rhythm is irregular, which would attest for atrial fibrillation with a rapid ventricular rate of approximately 200 beats per minute. It has a normal axis deviation, and no left ventricular hypertrophy and no infarction noted.
All right,
Thank you.
thank you.